right, welcome everybody to our May BHPAC meeting. So happy everyone is here. It's lovely to see you and be together today. I will call our May meeting to order. And we'll also just jump right into roll call here. Okay. Aaron Black. Natalie Brown.
Hope, could you please verbalize absent if that council member isn't here? We noticed that it's a little bit difficult to capture it in our notes and on the recording when they're not present. Thank you so much.
Absolutely. So with Aaron Black, there was no answer, so absent. Thanks for that feedback, Judith. Natalie Brown.
This is Calandra. Natalie Brown is just joining. Maybe say it one more time.
Sure, thank you for that. Natalie Brown.
Good morning, I'm present.
Morning, thank you. Savannah Brown.
Good morning, everyone. I'm present.
Good morning. Charles Davis. So at this time, Charles Davis is absent. Carrie Eckert.
Good morning, I'm here.
Good morning.
Good morning.
Jacob Fry.
Good morning, everybody present.
Good morning, thank you. Sean Gartrell. Excuse me.
Yeah, I'm here.
Thank you.
I'm here. Good morning.
Kelly George.
I'm here. Good morning.
Good morning. Laureen Gilroy, excuse me.
Present. I'm here.
Marjorie Grimsley.
Present.
Jenny Gwencheva. Looks like Jenny is absent. Danielle House.
Danielle is logging on momentarily. I've just resent that invite. So just one moment, she may join here soon.
Okay. Thank you. I'll come back to Danielle. Stephanie Johnson.
I'm here, Danielle.
Hi, Danielle. Thank you. Looks like Stephanie Johnson is absent. My lovely co-chair, Megan Lovelace.
Present.
Candace Ludwig. Looks like Candace is absent. Dr. Asia Lyons. Looks like Dr. Lyons is absent. Excuse me, Sharon Mock.
Present. Good morning.
Thank you. Good morning. Michael Miller. Looks like Michael is absent. Dennis Streeter.
Here I am.
Morning. Angie Wold.
Good morning, present.
Thank you. And Annette Zacharias.
Present.
Awesome. Thank you. Turn the floor over to our lovely State Department people that we're so grateful that you're here today. So if you would come off mute and introduce yourselves, please.
Hi, everybody. Alita Andrews. I'm the Recovery Services Manager here at the BHA.
Morning, everybody. Nice to see you. Tom Miller. I'm the Division Director. Hi, Division Director for Quality and Standards. Nice to see you.
Good morning, everyone. Megan Shelton, Director of Strategy Planning and Engagement, and I serve on as the BHA representative for BHPAC.
Good morning, everybody. I'm Kristen Toombs. I am a Deputy Director at the Division of Housing within the Department of Local Affairs and DOLA, and serve as DOLA's representative here. And I will be in and out because we have a few meetings that I have to pop in and out of, so I apologize, but I'm glad to be here with you all.
I can introduce myself. My name is Chris Labana-Fristovsky, and I'm the Deputy Director for the Colorado Division of Criminal Justice within the Department of Public Safety.
My name is Bonnie Holiday, and I'm your prevention technical assistance provider. So I'm here to connect you to all things prevention, resources, and supports. And I'm based out of the Colorado Department of Public Health and Environment in the Prevention Services Division.
I think that's all for the council members. My name is Judith Tioku. I am the Community Engagement Manager here at BHA. I'll hand it over to Calandra.
Good morning, everyone. I am the floating BHA logo this morning. Calandra Lindstadt, she, her, they, them pronouns. I am your Northeastern Regional Community Engagement Specialist, and then I'm also your statewide agricultural liaison.
Sammy, please introduce yourself. Thank you.
Good morning. I am Samantha Warner, and I go by she, her, and I'm a program assistant for Dr. Aisha Rousseau and also for Megan Shelton.
So good morning. My name is Ann Denton. I am here as your SAMHSA Planning Council Technical Assistance Provider.
Is that everyone?
She did, Tasha.
Yes, Tasha, I did. I apologize. I was at the ED late last night with my kiddo, so a little sleep deprived this morning. So I meant BPAC representative. And then, as you all know, I oversee our BHAC Council as well. So thank you for the correction, Tasha.
We hope your kiddo's okay, Megan.
Yeah.
Thank you. All's good.
Okay. Thanks, everybody. Thank you for being here. Our next order of business is to approve our April 3rd meeting minutes.
I had a question about them because I thought Aaron Black wasn't present last time. And yet there are several things in the minutes that were ascribed to her. And I was like, oh, I thought Aaron wasn't here.
From the April minute, she was excused, yes. One moment, please. I'll go through that and check. Thank you. Thanks for flagging that.
Well, and there was a couple of things that I was like, I thought that it was Megan Lovelace who actually said a couple of those things. and it wasn't Aaron. And I was like, but Megan, I'm going to just say, I don't remember. You had so many great contributions to the last meeting, but I was like, you probably know which ones were actually your words.
I love that you think I remember everything I said. Thank you. I can review those minutes. Should we put off a motion to approve if that's the case? I would have to go back and look at them. My apologies.
What a great call out, Annette. Thank you so much. And I think we give some space to figure out who was the appropriate author of the comments and push the motion to approve our meeting minutes till we get that figured out. Sound good? Okay, we'll come back to that. Next up is our discussion on last month's presentation from the fiscal data team on our mental health block grant reporting updates. Provide some space for some discussion, any questions, any feedback. Oh. Thank you. Before we run into that, I guess we first need to establish quorum. I guess based on, do we have quorum today?
Yes, Hope, it looks like we do have quorum for today's meeting.
Okay. Thank you. That's important. Thank you, Judith. And Megan, looks like we can move into a discussion of our last month's presentation on the reporting updates. Does anyone have any questions that we can bring to the BHA? Dennis?
Yeah, one of the things at our last meeting, we, for the second time, failed to have enough people to elect a chair, and we're struggling a little bit in getting people that have already committed to be on these subcommittees to actually show up. And the block grant funding subcommittee is probably the most single important committee we have. And at that last meeting, we decided to bring it up here and try and get some consensus on, getting a chair and vice chair appointed. I don't know how the council feels about that, but that was something that is really bogging us down right now in that subcommittee.
Okay, thank you, Dennis. Can we push this down when we start talking about membership recruitment, get through this kind of review and circle back, because this is very important. I think I'd like to touch on that. So if that's okay with everyone, we will circle back to that during the membership portion of our agenda. But thank you for bringing that up, Dennis. This is very important. Any questions, comments, feedback from the lovely presentation we had back in April? I know it's a lot to digest when we talk about data and how it's captured and how it's reported. So just holding some space if anyone had any follow-up questions, feedback for the BHA.
I would just remind everybody that the data presentation, this presentation was really important because in the block grant review last year, one of the key points in the letter that y'all submitted to the department was lack of data and lack of information about the block grant funding allocations in general. And so as you move forward into the block grant review for this year, I think that that this data presentation answered some of those questions.
And I think that that's a good point. So, you know, and I think that as we start talking about the block grant, I think that we need to have this at a forefront because maybe that would direct us to have different kinds of recommendations based on who we now know that we're serving.
I have a question about priorities, I think. In the reading that I did very quickly, there is a state effort funded by some grant, I think, to redo some things in the next 4 years. Are any bells ringing? Okay, I don't remember exactly what it was, but it seemed to be different from the block grant funding, and I'm wondering how much time and energy we'll devote to the first thing that I can't remember what it was. I'm sorry. Nobody knows.
Well, I'm an outsider and don't remember the particulars of that. But if I'm getting the question right, you're really asking, is there an overlap there, or will there be competing priorities? And for all of the initiatives that the department is launching or funding that's either going away or coming in a different way, that for the block grant committee and for the state, those are crucial questions. Are the priorities competing, or is there overlap? Because where there's overlap, then you may be able to shift plans for funding on either side, so you're not duplicating effort.
Thank you very much, Anne.
So, Lorraine, to your question, and I wonder if this is something we bring to maybe the BHA policy team. They might know like some of the ins and outs of how that money's been shifting around and what might be duplicative in that space. So maybe I know that we're going to have Ryan later. Maybe we ask him if he might have a little more information about that, Lorraine, and what that looks like.
Okay, thank you. And I'll try to find where I read it and what it is. So, sorry.
Don't be sorry. That's a great question.
It was in one of the slide decks in the past 2 meetings.
I think, again, we need to understand that the subcommittee should be reviewing this and making the recommendations. And again, that's why it's crucially important that we get a chair and vice chair and have a productive meeting to be able to address these very specific questions. And I was part of the committee last year, and that Ann referenced. And again, our request to have more information and more detail about the actual grantees and the grant programs were a big part of our push last year. And I would expect and hope that the subcommittee will pick that up and even expand upon it. But this particular presentation is something the subcommittee needs to review and make our recommendations to the whole council. Again, that will answer a lot of questions, I believe. And Ann will be, I'm sure, part of that as well.
Yes, sir.
And we do have the invite for the block grant subcommittee in the chat because I know all of you are so excited to join that subcommittee, and we're just raising that invite again to y'all. Come and join the awesome party, and let's do this.
And I remember last month when we were talking about this awesome party, we were going to also share the day and time of when this meeting is so that the council can also see that. So if someone wouldn't mind sharing that in the
I'll share
chat
that
for us.
in
Thank
a
you,
moment.
Judith, so that we can all know when this really fun subcommittee party is happening.
Right. And everybody's invited, by the way. You do not have to be a subcommittee member to be at the meeting. These are sunshine meetings. So if you want to come and see what's going on and contribute in that direction, that's fine too.
So it's on the second Wednesdays of the month. The next meeting is on May 14th. I'll drop the BHA event calendar link in the chat. It's got all the meeting links in there. May 14th at 9 a.m.
Thank you, Judith. That's very helpful. So we've got the time, second Wednesday at 9 a.m. and the invitation for the subcommittee also in the chat. So thank you for that. Any other, excuse me, questions or feedback, comments on the presentation from last month, the reporting updates? This feels like a very seamless transition to turn it over to you, Anne, for any SAMHSA updates. And we're just so grateful to have you here and lovely to be with you today. So thank you.
Yes. Thanks, Hope. Yeah, Colorado requested additional technical assistance hours from SAMHSA, and it was approved. So you'll have my assistance with subcommittees and these meetings and anything else that I can help with through the fiscal year. It'll end in the end of the federal fiscal year. So that's good news. And the rest of it is, we just don't know. We are hearing through the grapevine that the mental health block grant application will drop late rather than early, but we don't know that for sure. That's what, it's like a game of telephone when we were children, right? By the time you get to the end, you just don't know what's true and what's not. It seems logical that it might be delayed. Our assumption and what we're hearing informally is that they're scrubbing it for DEI, taking any references to DEI out of everything at SAMHSA. But again, I wish I was the bearer of better news or more definitive information, but we just don't know.
Thank you. And when does it's the date that the RFP typically drops in the fiscal year?
Yeah, it usually is about June, May or June, and then it's due in August typically. So it could drop any day, but I don't think so. Is the short version of what I think I know.
Thank you for sharing that. Marjorie.
Wondering, does that scrubbing of DEI references, does that trickle down to actually even planning council bylaws? Any language that is there, or I'm thinking in terms of membership, recruitment. I mean, do we need to look into that level of detail? Or I know when we had our membership meeting this week, Dennis said, we were really going under state. The state was driving our work. I guess I just get confused or paranoid or whatever the right word might be as to what level we need to be re-looking at.
There's nothing official coming from SAMHSA, right? So there's nothing to roll down. There's nothing to roll out at this point that's official. And I think when it is official, we will let you know. But I imagine there seems to be a great deal of discretion within the boundaries of what the law is about the block grant, which includes the planning council. So within the boundaries of the law, states have had a significant amount of discretion. So I think we need to wait and see.
I did have a question about that scrubbing of the DEI. Now, is that the SAMHSA is, I'm kind of new at all the acronyms and everything, but SAMHSA, is that totally federal, or does it turn
It's
to
HHS, it's Health and Human Services, and it's SAMHSA's Substance Abuse Mental Health Services Administration, and the block grant funding comes through them.
Okay, now this scrubbing of DEI, I understand that I guess an executive order is not law. So maybe I need to have a better understanding of why this is, I guess, it has to be done. And like, how is the state of Colorado dealing with it?
Yeah. Let me back up and be really clear. What I was sharing about that is the informal information we're getting from some people that we know, some back channels that we know. It's nothing official from SAMHSA. However, whether an executive order is a legal order or not, I think SAMHSA has to make their own sort of decision about compliance with that. And we don't have no control over that. I think the better question is the one you've also asked, Savannah, which is the state's response to anything that comes. We have nothing official from SAMHSA at all. But if something does come, how will you prepare, to make a state response to that?
Yes, could you let us know if you hear anything about how the state of Colorado is going to respond?
Yeah, I wouldn't be hearing that. You all are much closer to what the state is doing or has done about all of that.
Okay. Well, whoever that, I don't know who that would be, but
yeah.
To everyone listening, as soon as possible. I'm very much interested in that, and would like to be able to have a voice in that, if possible.
Great questions.
Megan.
I just see Tom off mute. I was going to ask Tom to speak to that if he could, or if any of our other state partners could speak to that. I know Department of Education has put out a statement, but yield to Tom.
Thank you, Megan. And so with leave of the committee, I can comment on a few of those things as a representative from the Behavioral Health Administration. I very much appreciate the questions. And would echo part of what our federal partners are saying in terms of we don't know a whole lot. There's a lot of wait and see happening, but there are some specific things that the state of Colorado is doing. So, for instance, that there was an executive order that rolled back ARPA funding stopped it, really, that was to go through September of this year. So that affected approximately 30 of our providers, because the dollars that come to us from federal government, we pass through to providers with whom we contract and license. So we notified them that that money ended that day. Well, there was a lawsuit filed by the state of Colorado, joined with a number of other states. I think it might have been 18, that said that that was an impermissible action by the administration, and the courts agreed. So that money started to flow again with the week in between when that court injunction took place. So that's a very specific thing that Colorado has done to try to keep those ARPA funds flowing until they were previously designed to end, again, September of this year. There are several other examples of that that are less specific to mental health block grant dollars, for instance. An example would be that Colorado also joined a number of other states that's filing suit against the Trump administration for tariffs and how that impermissibly affects business in the state of Colorado. So those are just two examples of when this administration takes a particular action, Colorado may choose to file its own lawsuit or join other states in a lawsuit to prevent that particular action. Now, that's going to be a state by state decision. In both those cases, Colorado joined another number of other states, so probably around 20 or fewer. And so, depending on how those states accept and use federal dollars, can also drive how those particular states respond. So, Savannah, I hope that that answers a little bit. If you have a more specific question, I'll certainly try to answer that.
Thank you for that. Thank you.
You are welcome. Any other questions along those lines? Again, I would just say and repeat part of what Ann said a little bit earlier. We're not exactly sure what's coming from day to day or week to week. It is our intent to make sure that services, whenever possible, continue in a seamless manner. But we're concerned. There's no getting around it. I think that the other big thing that's happening, and this is a state specific, is that we have our own pretty major budget shortfall, amounts to about $1.2 billion. So that may limit Colorado's ability to step in and put dollars in place of what we may lose federally. Medicaid and Medicaid waivers in particular are the things that we're most worried about. Now, I don't want to go too far in the weeds, but I'll just say very quickly, we do have some idea of what this current administration's budget plans are that they will be submitting to Congress. And those include eliminating a number of federal departments, and also alludes to rollbacks of certain Medicaid waivers. That could be pretty catastrophic. There's no reason to hide the ball on that. So we have to see whether Congress is willing to adopt those changes from this administration. That doesn't always happen. Congress is not obligated to do that. This particular administration and this particular Congress is a little bit different than we've seen before. So I'm not sure what that holds, but we should know more in the next 2 weeks. So I thought I'd give that little bit of information of what's coming up now. Congress is back in session, so they'll be hearing those things soon. Megan?
Thank you for bringing up that federal stuff, Tom. I think that's super important. And just so you know, those are called like budget markups. They're in the Energy and Commerce Committee, which one of our Colorado delegations serves on. That's Congressman Gabe Evans. His legislative director is Scott Watson. I will be dropping his email into the chat. Most certainly, I am not suggesting that you contact that particular individual, but you are certainly welcome to share your concerns around Medicaid cuts with his legislative director. They will be marking that up this week. Next week. On we think the 7th and the 8th. That means putting numbers next to the budget. So they'll say what they'll cut and how much. So you are always free to reach out to your representative.
Yes, I do that frequently. Thank you so much for that. I will take note of that email address.
There's a question for Tom in the chat from Bonnie. Are these home and community-based service Medicaid waivers?
That's not something that BHA does, but it's my understanding that those are exactly the waivers that have been targeted along with other kinds of Medicaid waivers that do support people receiving mental health and substance use treatment services. So it's really a lot of different Medicaid waivers. Now, the HCBS is housed within an office at Healthcare Policy and Financing. So those effects and what HCPAC will do about that are questions best directed to them. But we are also working with Healthcare Policy and Financing on ramifications of waivers that support people that receive services from BHA or receive services from organizations that we license from BHA. So we're trying to have contingency plans if those things happen. To not to put too fine a point on it, what we have heard is that the administration has made some statements to roll back the Medicaid program to be primarily a health insurance for low-income Americans. So how Medicaid existed prior to Medicaid waivers, so waivers of those particular rules that expanded the funding to do more than just be a health insurance. Those are some of the statements that we've heard. Again, and as Megan rightly pointed out, we should know more in the next couple of weeks about whether those kinds of things gain traction or not. So, Bonnie, hope that answered.
It does. Thank you very much, Tom.
Yeah. Do you know Colin over there?
I used to be a temp under him, so yeah.
I actually thought I remembered that. So he's the person that has a bunch of that information and understands ramifications when it comes to HCBS programs.
Thank you so much, Tom, for providing that information, and Megan as well for the support and additional information. This is really important.
I'm sorry, Hope, I cut you off. I just wanted to say I recognize I'm later on the agenda, so I didn't want to dominate, but happy to try to answer other questions y'all might have.
Marjorie.
I just real quickly, and I just want to add that is something I don't know if the work that we're doing needs to at least keep on the radar of what the impact of these changes could make. I know that there are policies and I'll just say the Child Youth Mental Health Treatment Act, when we were doing that work, Medicaid, because of these waivers, we did things differently in different ways. If those waivers are then taken away, it means we will have to relook at a lot of the things that we are now doing, because we can no longer assume that Medicaid waivers will serve that population. So I don't know how it links with the block grant, but I think we really always need to keep in mind when there's a switch in the balance of how we're doing things, it's a ripple effect. And it really is important. And going back with the data, what we learned last month, we really need to be collecting not just the data of what is happening to the people being served, but then also what has happened to those that no longer are being served, because it will be equally important for us to understand that moving forward. It's great if the people still receiving services are doing well. It's awful if we're not recognizing those that aren't. And sorry for my passion in this, but it's very scary. Thank you.
Thank you, Marjorie. That was very eloquently put, and the concern here. Absolutely. Thank you so much for sharing that.
I just want to raise up the chat here. Lots of people feeling what you said, Margie. Thank you for voicing that. It's really important, and waivers are something that we all rely on to keep the people we love safe, healthy, and in community. And that is a part of what the work we do every day, right? Even if the waivers live in HICPUC, it doesn't mean it doesn't touch us here and the work we do at BPAC.
Thanks for that, Megan. It feels like we have a very apropos agenda item where we wanted to just kind of hold some space. Here we are for this council, just offering this collective support for one another, and in where we are in this very scary uncertainty of what's coming and what's happening. And so just want to honor everyone in this space and the work that you do and the impact that we have for our communities and the people of Colorado. Creating a supportive space here for all of us is incredibly important, and just honoring that we are here for each other. Looking in at just this space of what could be happening, we don't know, and how do we continue to exist and take care of ourselves and each other in a space that's so uncertain and so uncomfortable and confusing.
To your end, I think that, over 50% of us are living with or, some sort of mental illness or addiction or something, or have a loved one who is. And this uncertainty is just the worst for those who are vulnerable like this. To think that maybe they won't have access to services and stuff is really derailing. And so thanks for giving space to that, because I think that a lot of us in this room today are dealing with our loved ones who are really, really concerned and struggling and worried. And, I know that I run a homeless shelter, so a lot of folks that I see every day are greatly affected by the possibility of losing benefits. And you're right, Megan, and we're scared. Like we're scared that what happens if we don't have someone to help us pay for the very expensive services that are required to stay stable.
Totally okay to cry and feel sad and scared and all the other feelings we feel. And we all on this call, and many of us serving the community across the state, are looking directly at that fear, right? Knowing how many people are relying on us to do the work we do. So this is a great space for us to support each other and share hope and love, but also admit that it's scary because it is. It's scary, you guys. It's not scary.
I appreciate the vulnerability also on this call. We're showing up here as we are, and you are not alone. We are a council and we're here for each other. I don't want to take away from where we are in this moment. I know things are heavy and there's a lot of feelings here. And I also want to acknowledge that we do have a pretty full agenda and want to keep moving forward. That feels really awful to do. I don't like this at all. And it's part of what we have to do. So just as a council, we are here, we support each other. Let us know what supports you need during this time. And I'm just grateful to be here. And I thank you all so much for all that you do. And I think as we do what we do, we can't do that without taking care of ourselves first. So self-care, doing what we need to do to be there for ourselves first, so that we can show up and continue to do this work, even in the scary, uncertain space. Next, we need to get into some membership recruitment. It's that time of year. Feels like and bring more individuals into our collective space to continue to support and do this work together. In our agenda is the application to share for membership recruitment. Unfortunately, I was not able to attend our meeting on Monday. I had jury duty. And so I'm going to turn it over to someone from that was at our membership recruitment, because I think it's helpful to understand I believe we spoke about this recently on specifically, are we recruiting from a specific population? What are we seeking? What seats are we seeking to fill in our council from what different communities? I would like somebody from membership to speak to that, or Judith to speak to that part, but we've got the application in here and it's time to do our recruiting. So I'll turn it over. Dennis, do you want to speak to membership recruitment? Whoops, you're on mute still. Whoop, you're still on mute.
Thank you.
There we go.
Okay, for anybody who doesn't know, I'm the membership chair, and I also serve as the chair of the systems committees. What we, and again, I spent a lot of time talking about this at our meeting, and I have gotten quite a bit of clarity from Caitlin before she was reassigned temporarily. Here's the deal, and this is what is different. We have a much more formal system now for membership, and Margie, being one of the longer members, talked at that meeting about how informal it used to be. Well, now it is going, by edict all the way to Commissioner Smith for final approval. Caitlin had told me that all the qualifications of members, reviews of the applications will be done by the membership committee, and that members will be recommended to the whole council prior to that final, which we're being told is more of a rubber stamp than anything. So that's part of it. The other thing Caitlin approached me with, my first term ends, and I had to actually fill out a new application to apply for a second term, even though our bylaws allow for a continuous of 2 terms. The new system says we have to apply and we have to be approved. So that is another move. I do want to welcome Madeline Mackey, one of my recruits through an organization, CHOW, which is a wonderful peer organization on food service and hospitality industry. And again, I have a podcast interview with them. So anyone who wants to find out more about the work that Chow does, it is posted on the website now. I invited Madeline to be at the meeting now. The new system says the actual term starts October 1st. And
Dennis, I'm so sorry to cut you off. It looks like we are a little behind in our agenda, and Tom, who's here to do a presentation, needs to hop off soon. So I'm sorry, we're gonna just kind of derail or pump the brakes and then move quickly to be able to accommodate Tom's presentation before Tom has to leave. So I'm sorry, excuse me for interrupting, and quick shift. I know we still need to get to a break. We will take a break after Tom. We're going to turn the floor over to you while we have you in our meeting. Thank you.
Thanks very much, Hope. And I'm sorry, I've got several overlapping meetings. I know that y'all probably have exactly those same issues. So I just wanted to do a quick level set of what we do in quality and standards, and then talk a little bit about rules, but also really make it accessible in terms of what do you want to hear about rules. I've got a PowerPoint, I can walk through that, but I think Megan has helped coach me that maybe sometimes conversations are a little bit nicer way to interact. So I'll proceed that way first, and then thank you for the thumbs up. And then if you want a more formal presentation, can certainly head that way. But first, in terms of quality and standards, if I haven't spoken with you before, you may wonder exactly what that means. So the easiest way to describe it is that folks in the quality and standards group do the licensing activities with about 900 behavioral health providers across the state of Colorado. So that sounds like what you think it is. These organizations will apply for a license with folks in my group, and if they meet the regulatory requirements, we'll grant that application and go out and do an initial audit, give them a license to operate, and then we take complaints, critical incident reports, do investigations, and then that yearly renewal license, depending on facility type. So really what we say to ourselves in this part of the organization is that we make sure that people getting behavioral health services get high quality services. And if something goes wrong, we step in to correct that action. And in times where that organization can't correct, we will close that organization down. So that's definitely an aspect of what we do in quality and standards. That's a big chunk of our time and why we think our work is so important. Another big part, and then this is really the main point that I wanted to share with you, is about regulatory drafting. So when there's a bill that's passed and we have to say, all right, we need to set up a new set of regulations to make that new program happen. I've got a team of regulatory drafters, folks that draft and then engage with you in the community to make sure we're writing those rules in the correct way and then present them to the State Board of Human Services, our Type 1 state board, to make those new programs happen. A great example of that is the requirement that passed last year in the legislature to require Behavioral Health Administration to designate eating disorder facilities. So that's a great example of a law that passed. Ryan worked on that with his legislative liaison. That passed through, became law. We will draft regulations, engage with you as important community members, recipients of service, make those regulations real, and then we will start to issue designations for those facility types and then do the quality oversight of that. So just wanted to give that an example of kind of the life cycle of what happens in quality and standards. With that part being said, I also thought maybe three main areas to talk about in terms of upcoming regulatory activity. The first is a big presentation we're making to the State Board of Human Services next Friday on the 9th. And then I would be remiss if I didn't point out that your own Megan Lovelace is a brand new member of the State Board of Human Services. And so it will be lovely to see you in that context. Please be nice to me. No, I'm kidding. If I'm not doing something right, you ask me lots of hard questions and make sure that we're doing a good job in terms of those rules. So what we're bringing in that particular packet are provider rules and administrative rules. The provider rules are going to talk about chapters 1, 12, 14, 11, and 13. Now, that probably doesn't necessarily mean a whole lot. So chapter 1 is where we put all of our general statutory authority and definitions. We're changing some of those to align with things that go in those other chapters. Chapter 11 is our 2765 designation. 2765 refers to a section of Colorado statute that speaks to the quality of services and the rights that people that are receiving voluntary and involuntary mental health services in a facility. So that's a big part of what we do, and we're making changes in that based on some laws that have changed. Feeding tubes and electroconvulsive therapy, to be specific. We are changing some technical things in our safety net provider rule. This is really about aligning funding models with healthcare policy and financing that pays a lot of those enhanced rates. A huge change for us is controlled substance licensing. This is an organization that may store, compound, and dispense controlled substances that we are aligning with the federal government, who has become much more progressive in terms of things like take-home dosing and when a person receiving those kinds of services can start take-home dosing. So our rules are aligning with the feds in that way. Fantastic. And then last is kind of a technical change in terms of moving recovery support service organization approval from a legacy rule volume into a new rule volume. Nothing's changing there, just a move. Now, that's all the provider rules. On the administrative rule part, we are going to talk about our behavioral health administrative service organizations to the board, and then some changes with the children's system of care. So in particular, assessments that kids get in those systems, and seek the board's approval on those things. So that was one chunk of what I wanted you to hear. I'll pause very quickly and see if there's any questions about any of that. Tasha, thank you for asking.
Thank you, Tom. My question, right quick, just some clarification when you're talking about the controlled substances. Does that have to include mental health controlled substances treatment, or is that just the medicated assisted when it comes to recovery? When it comes to the, recovery supports?
Yeah, you got it. The latter. So think in terms of medicated assisted treatment. Also think in terms of buprenorphine and methadone, and people that are using that therapy on the pathway to recovery. And also think that these changes in alignment with the federal government are primarily aimed at destigmatizing those kinds of therapeutic interventions. So less of a criminal model and more of a recovery model, which is fantastic. Colorado was kind of out in front of that anyway, and we asked for lots of waivers from the federal government to do it the way we were doing. And really, I'd say the feds are kind of catching up with us. I would also like to take this opportunity to say that we have the benefit of having Ryan Mueller on the quality and standards team and working at BHA. He is the State Opioid Treatment Authority. We say SOTA for short. And he is an expert in this area. He used to work at Denver Health before he came to BHA. And he's been leading this charge on behalf of Colorado to modernize these services and also expand them. So under his leadership, we've nearly doubled the number of organizations that provide this kind of services, and also the number of organizations that have mobile units that can dispense methadone and Suboxone, which is just fantastic. That means we go to where people are rather than making them come to a centralized bricks and mortar to receive these services. Thanks for asking.
Thank you, Tom, for answering. I appreciate that.
The other two things I wanted to cover, and I know that I'm probably using up way more time, and Ryan Templeton's probably like, hey man, leave me a minute, is, okay, thank you. Certified community behavioral health clinics. Y'all have probably heard that referred to as CCBHC. This is a federal model of creating comprehensive service organizations, much like the models that we've created under comprehensive safety net services. Now, I think Ann's comments a little bit earlier also dovetail here. See the CCBHC model. We are in the middle of a planning grant working with our federal partners at SAMHSA. And we wonder about whether that funding continues. We are moving forward as if it is, but we are in the process of working with our steering committee and subcommittees to build a regulatory package for how organizations that seek to be a clinic under this model and how they would do so in terms of certification and decertification, and the reporting requirements and the funding methodology that attaches to the CCBHC model. So that's another big regulatory and data reporting lift that we're taking on right now. Again, made somewhat more difficult given some of the uncertainties from our federal partners. Any questions about that particular upcoming regulatory activity? Yes, Marjorie.
I just had a quick question. If the work you're doing, let's say the funding, hopefully this isn't the case, but the funding does go away from federal, will the work that you're doing be a blueprint for us to continue to use and figure out how to fund those? Or do those get put on a shelf and then we just proceed? I think that is, for those of us that have been doing this a long time, we often see things for whatever reason that don't get implemented get lost. And it seems like when this work is being done so intensely, how can we ensure that we're not losing it? We just are having to find other ways to fund it.
What an insightful question. I really appreciate you pointing out parts of that and asking the important question. I would say it's helpful for folks on the call to know that Colorado, again, a little bit different than some other states, because several years ago, part of the requirement that created the Behavioral Health Administration also required us to invent a safety net system. I'm not talking about like the big concept safety net, but the provider type safety net. So that's what I mean when I say comprehensive and essential safety net. These are two provider types for which BHA and my team approves. Along with that came very specific requirements, particularly for comprehensives, of the types of service that they have to provide. And requirements for no refusal means if you're approved as a comprehensive safety net provider, you can't refuse services to individuals, something we know that has happened in behavioral health systems in the past. For all that, these providers get an enhanced rate of payment. These features are things that exist in the CCBHC model. And for states that haven't done what Colorado's done to invent a safety net system, these things are pretty revolutionary. We think that Colorado is going to have still some improvements and perhaps expansion of the provider network, but we think that we've basically made this revolutionary leap already. Now, to your specific question, there are still parts of the CCBHC model that we think are improvements, and we are already adapting those into our regulatory framework for behavioral health entity, that's a license type, and comprehensive safety net providers. So the short answer to your question, I realize I just gave the long answer, but the short answer is we are learning lessons and attempting to integrate those lessons into our current regulatory framework. We think of regulations as an ever-evolving system of quality oversight. It's not a one-time and we're done regulations and then they get put up on the shelf over here above me. We are constantly going back and asking you as our important community members, hey, what can we do to make it better? So that's part of what we're doing when we go present to Megan next Friday and say, hey, here's the next version of our rules. And you know what? We're going to be back later in the summer, and then we're going to be back later next year. And then, so hopefully that's an answer. Then I'll very quickly pivot to the third thing, and that is the American Society of Addiction Medicine has come out with the 4th volume of its standards. Our current regulatory framework, particularly for substance use, is predicated upon that ASAM standard. This next standard does more to integrate withdrawal management into other residential levels of care. And that's going to be a huge lift for our providers and also in terms of what the regulations are. So we're working on that right now. And so that's more regulation that we will bring to Megan and continue to drive this system forward in terms of if you show up to seek services and we know that substance use, withdrawal management, and mental health services are frequently combined, that we are moving to a place in Colorado where providers will be able to do all three of those things. So that's part of what that regulatory change that we're working on, this will probably be more like an 18-month process, is bringing. So those are the three main things I wanted to cover. Happy to take any questions. I think I may have seen a hand from you, Laureen, and I just kept on rolling if we want to go back to you.
That's okay, Tom. You answered my question. I was wondering about the opportunities for public input, and you said that you go back over time. Hi, here's the regulations we're working on now. What do you think? So that's what I was wondering about.
Thank you for asking that. To get to where we are with the regulatory package we're bringing to the state board next Friday, we did 19 community engagements. 11 of those were in person. And in fact, Ryan Templeton and I did basically a tour of all of Colorado to do those in-person ones. And we emphasized getting to more rural parts of Colorado. And even though our attendance was low in those rural parts of Colorado, we thought that that was so important because I think, I don't want to badmouth state government, but traditionally, state government tends to do its work in the Front Range and maybe even just Denver. So we did a lot of driving, sometimes in bad weather, to get to folks that normally we wouldn't get to. So the others we did virtually, but I would also be remiss to say that we also tried to emphasize those community engagement meetings at times when hopefully it's more convenient for people who are accessing services, specifically in the evening. So we try to have several evening sessions. We hope to do more of that these next regulatory go-arounds. But then I also want to point out that anytime we present to the State Board of Human Services, these are open hearings. So you and your friends and your family members and provider organizations can come and speak directly to Megan and the rest of the state board and say, that Tom Miller guy, these are the worst rules ever, and I tried to tell him and he wouldn't listen. Or maybe you can say, actually, it was great, and they did listen and they worked that into the rules. So we wanted to offer our positive support of this rules. But keep in mind, that's another place for you as community members to engage and directly with the state board. We're going to have 2 hearings. May is the first. So if there's any feedback we get from the board or people that come to testify, we will attempt to make those changes in the rule and then come back after 2 months and present and ask for adoption of the rules. So thank you, Laureen. Any other questions? And then I'll give my time over to Ryan. Thank you for saying so, Sharon. Thank you, Megan. It was a pleasure to be in Leadville.
I owe you guys some elk. When they came up, I had just some off the tour, and I just gotten an elk, and so I had to leave the meeting to go dress my elk. So whoever wants elk, I have a lot of it.
I would say, for the record, you promised Ryan and me elk, and I didn't get any. Ryan, did you get any?
No, but I got wonderful cookies at a different time from Megan. So
I'll bring some elk to the state board.
Yeah.
So weird. That's such a Colorado thing, though. I'm just going to bring my cooler of elk, which I cannot sell because it is game, but I can gift to people. And I would love to gift y'all some elk.
You're very generous. Thank you for everything. Any other questions from the team here? I really appreciate your time. Thanks for everything that you do.
Thank you so much, Tom. Thanks for everything you do. Thank you for being here.
Thank you.
All right, just going to keep moving along here. And Ryan, we're going to turn it over to you for our legislative update.
Well, first off, good morning, BPAC. Tom's nice, calming voice is probably going to be met like nails on a chalkboard with me talking too fast and generally, yeah, chaotic at times. With that, today is day 114 of 120 of the 2025 legislative session. So that means there's 6 days left, right? The last day is Wednesday. So wrapping it up here, it is wild at times at the Capitol. I was over there this morning. There's also this time of year where it feels like there's a lot of like schools coming to the Capitol. So there's just a lot of kids and stuff, which is a ton of fun to have kids down there learning civics, right? Learning how to be involved in and taking on the role that you all have as people of Colorado to work with your legislators to get bills passed that meet your needs. So good to see those kids down there. It's just not a fantastic working environment, especially providing updates to a council like this. With that, like I said, May 7th is the last day. I want to highlight again, the Megan Lovelace went through a little bit of a ringer to get to the appointment to be a State Board of Human Services member. What that means is Megan was appointed by the governor, but that appointment needed to be confirmed by the Senate. So Megan and I think it was 5 other state board members had to go to a Senate committee hearing, talk about why this fits them, and then also get confirmed by the Senate as a whole, which happened earlier this week on the consent calendar because there's such fantastic and the right fits there. So Megan, with that, congratulations. I know there's been some delays there, stuff as this is part of that time of year where things get pushed back. And I think, right, you were scheduled for 1:30 in committee, and it probably went up there at what 5:30 or so. So just a few hours delayed. So with that, there's a lot of stuff happening. I will put in the 2025 bill dossier. It's one of those ones where I've given that to you a few times here to keep following. I think the last time I looked, there's about 40 or 45 bills on that. All of them have a connection to behavioral health, even though the title may not look like it. There's a lot of things that happened this year, especially related to funding. We had about a $1.2 billion budget gap that needed to be filled, right? So there's state departments took cuts, a lot of cuts to get to that $1.2 billion, making sure that our state budget was balanced. Our initial review has been BHA took about $12.5 million in cuts. That may seem like a lot. Half of those cuts are from money that we never saw. So part of that was $6 million was annualized to the Behavioral Health Administration, which was called to right size iMatter, right? So iMatter is a $5 million program. Last year, the General Assembly said, we think it should be an $11 million program. We said, no, we can still operate it at $5 million. So it looks like a $6 million iMatter cut to us, but it's still a $5 million program. So we never saw that additional $6 million. So $12.5 million does sound like a lot. Half of that was from iMatter. So with that, the long bill package was signed by the governor on Monday. So we have a budget. One thing to highlight is that we did not get our R1 or R2 requests. That was the care coordination request that we put forward for about $3.1 million. JBC did not move that forward as part of the balancing budget. And the other R2 for us was a kids assessing the gaps and the funding shortfalls within the kids system through an analysis. That was also not moved forward either. So we still have plans to do care coordination and deliver care coordination services kind of across the behavioral health system. Just the enhanced dollars from our request did not make it through as part of balanced budgeting there. If you're interested, that's Senate Bill 25206 is the state agency budgets that you can see in there. There's also about 70 or so what they're called orbital bills that are attached to the long bill as part of the long bill package that have additional funding considerations for specific types of programs that wouldn't be included in the long bill, but as part of a long bill package to make sure that the whole state is balanced there. So I said a lot there. Any questions about budget before we get into specific bills?
Ryan, just a clarification. Sorry, I did not raise my hand. You were not here earlier, but we were discussing some of the Medicaid cuts at the national level. Just a clarification that none of the state budget cuts or deficiencies are touching Medicaid waivers currently. Just a clarification, because the state budget has not messed with that.
Yep. Nope, it has not. So
good.
Right, there's stuff happening on the federal level, right?
Yes.
And even the state budget, when we talk about the $1.2 billion gap, that is a Colorado issue. That isn't, I mean, there's things swirling on the federal level that eventually may impact Colorado's budget, but it hasn't specifically yet. There's a whole lot of conversations about what that impact would be or could be, but the state budget gap is the state of Colorado's issue and not from the feds.
Thank you for that clarification. We're having a robust meeting, and perhaps there's been a misunderstanding between some of our state dollars and our federal dollars and how those are directed. So sorry to interrupt you, and thanks for that clarification.
No worries at all. Allowed me to put this into the chat. So that's the 2025 bill dossier. I think, what did I say, 40 or 50 bills in there. I'm going to highlight a few of those. So Senate Bill 9, the recognition of tribal court orders, that has passed. It passed in the middle of April. It has not been signed yet, but that makes various state agencies are required to recognize and enforce tribal court orders when it comes to like behavioral health commitments and arrest warrants and other types of tribal court orders, just to make sure that there's a better coordination between those sovereign nations and Colorado. I think that's a pretty big win to make sure that there is service delivery kind of across the board for all people in Colorado. I think we talked a little bit, or have been talking quite a bit here over the years, about competency. Senate Bill 41 is the competency in criminal justice and services, criminal justice services and bail. There's a connection there to service delivery as people moving through the court process for competency, right? If someone is identified to have a behavioral health concern and going through the court process so they can participate in their own defense. That's the competency piece. There's an evaluation restoration process that is through the Office of Civil and Forensics Mental Health. There's a pathway that people eventually move to a community-based behavioral health service delivery. So we're watching that one really, really closely, because there is a connection back to, if we have a good and robust community behavioral health system, ideally, less people are going through the criminal justice system. So we also have to have it when people are in the criminal justice system, they have a place to go when they ultimately get out of the criminal justice system. So there is some offshoots there about how it impacts behavioral health, or the civil side of behavioral health. So we're watching that one closely. It passed both chambers on, what was it, Tuesday, I think. It has not been signed yet, as it just passed both chambers there. So that's Senate Bill 41. Senate Bill 42, I think we talked about that last time. It had been governor signed March 26th. So that one's called the Behavioral Health Crisis Response Recommendations. Big piece for BHA there is working with our behavioral health administrative service organizations to report on reimbursement shortages and gaps for the crisis response system. So I think that's a big win for, hey, making sure that crisis service delivery is as robust as possible to meet the needs of Coloradans. Another piece to that is that it also enforces that HCPF will provide reimbursement for Medicaid members receiving inpatient mental health treatment for up to 60 days. Currently, it's reimbursed and capped at 15 days. So when Megan was talking about the waivers and the Medicaid waivers, this is a reinforcement of that waiver has passed, and now it's been put into state law for HCPF to execute on. Like I said, that was governor signed end of March. One that we've been watching closely this week that has passed now is Senate Bill 195. It's called Sunset Rule Alcohol and Substance Abuse Treatment. Don't let the sunset fool you. That is the continuation of that program. It had to go through a sunset review process that the Department of Regulatory Agencies does. So saying, is this program good? Does it need to continue? The answer was yes. So it's going to continue for another 5 years. What that does is it's a program that provides funding for youth substance abuse prevention, which is run out of the Department of Public Health and Environment, and it also pays for withdrawal management or detoxification services in rural areas. It's about $100,000 program that's split between BHA and CDPHE. So we watched that one closely. That has passed both chambers. So we are waiting on signatures on that one. Another one that has passed both chambers but has not been signed is Senate Bill 05.01.2025, which was suspend legislative interim committees. Part of budget balancing was the cost associated with interim committees is fairly high with paying for staff to staff those interim committees. Most of them have been suspended. One that I want to really highlight that was the behavioral health disorders in the criminal and juvenile justice system and the associated task force. A key piece to that, instead of having 5 bills that interim committee can run, it's only going to be 3. So I talked with Senator Amabile this morning. She is on the legislative interim committee and is pretty focused on making sure that it is community-based behavioral health service delivery for high acuity individuals, as well as making sure there's a coordination between substance use disorder and mental health service delivery. So we will be watching that one closely, or that committee closely, as that's this legislative process, even though it's only 120 days at the beginning of every calendar year, it really is year round. So last one for the Senate bill, Senate Bill 290. It passed House Health and Human Services Committee yesterday, so is referred to House Appropriations. What that one is stability payments for safety net providers. So this provides a funding stream for safety net providers, which safety net providers can apply to receive stability payments for providing services to low-income uninsured individuals at no cost or a sliding fee schedule. So what that means is that those safety net providers, they essentially submit applications to a board that reviews those applications to then issue stability payments. The key piece here is that safety net providers has a different meaning here than how we traditionally talk about safety net providers, right? We usually talk about safety net providers as essential safety net providers and comprehensive safety net providers. For this bill, it means comprehensive community behavioral health providers. It means rural health clinics. It means federally qualified health centers. And it means primary care offices with at least 50% client caseloads of Medicaid enrolled individuals. So those are the 4 groups of providers that can seek these stability payments as part of this piece of legislation. So this is a late part of this, kind of hence it was in House Health and Human Services yesterday, and it still needs to go through appropriations and then back to the House. We were watching closely about amendments to that bill in the second chamber, because if there was amendments to it, it would have to then go to the Senate to concur on the House amendments, which may put a delay on it, which may run out the time. So we're watching that one closely to see where that one lands, which for us, it's adding the potential for more dollars into the behavioral health system and the safety net system, which I think we could probably all agree is not a bad thing for behavioral health. I know we're already at 10:30 here. We just want to highlight one more House Bill 251132, the Military Family Behavioral Health Grant Program. That was in November, voters passed Proposition KK to create a tax on firearms, firearm parts, and ammunition, with those tax dollars paying for to support veterans' mental health programs as well as crisis response systems. That bill is being signed today by the governor at the Capitol at noon. So excited about that one. It provides additional grant opportunities for people to receive services, specifically military and families of military. So excited about that. I put the bill dossier in there. Megan's been adding some stuff there with Senate Bill 42 as well. So any questions that I can answer? Not hearing anything. If I get the invite for next month, we can kind of have a budget wrap up and a legislative wrap up, as it will be right already into whatever the month is after May, June. So beginning of June. So a little time to
Do you guys,
decompress.
I'll ask Ryan, do you guys have like a any kind of public process currently around as you all think through next year's legislative session? We know this one's not over, but it almost is. After y'all take a well-deserved break, we know y'all are going to come back over the summertime and start thinking about next year's legislative session. I know that the commissioner will have some listening sessions throughout the summer, and I wonder if part of that will include, you know, maybe just an opportunity for the public to huddle with you all and think through potential legislative priorities moving into next session. As we have heard on this call and kind of across the state, people are worried about federal budget and all these things. So getting creative with policy. What is the public's opportunity to participate with your policy team there?
So a little behind the curtain of state government is we are currently going through that process right now with how do we get to a spot of what are our ideas within state government. That has to run. We are part of the executive branch, so run all the way through the Gov's office to move those forward. But we are hoping that summer into fall that we have the approval to have those conversations about moving those forward and also seek sponsorship already into the fall in preparation for 2026. I think that is an important piece of community involvement in those things about what is BHA thinking that their legislative agenda. We only had one legislative agenda bill for BHA this session. That was Universal Contracting Provisions 1124, House Bill 25 1124. We are trying to expand that bigger to have a bigger legislative impact moving forward as well. One of the things that we did get from the Joint Budget Committee was a request for information about how we at BHA can come up with ideas for consolidating budget line items. So what that means is how BHA can potentially create flexibility in spending and dollars that JBC is interested in hearing how BHA thinks that could happen. So that will be a highlight for when we go to BHA's JBC budget hearing as well, which is really November, December time as well. So Megan, exactly right, is that with listening tours and community conversations, I think there is a big opportunity to really drive home from a legislative standpoint, as well as what Tom talked about is the regulatory piece and how those things fit together to actually create a system that is impactful for the people of Colorado.
Thanks.
With that, without any other questions or hope, I saw you come off, so come back to you, or you got a question for me as well?
I was just waiting to see if there was any other questions for you, Ryan. Thank you so much for your comprehensive update and being here with us today. Coming from the Capitol, straight to come join us. We appreciate you and all that you're doing. And I really also, Megan, thank you for that question. I think it's important to understand how the public can be involved in this process. So thank you both. And if there are no other questions for Ryan at this time, we're going to slide right into our Basso Regional Council review.
Thank you, Hope. Conjo, could you please share the slides? And I will share them in the chat as well. Megan had to hop off, and so I will attempt to do a presentation for the Basso Regional Councils. She will be here next month, so please do, after the meeting, really dig into the slides and then come next month with all your great questions, and she'll be able to really dig into those and share more updates with you. Thank you. So this is This is just an overview of the regional council for the BASOs, the two BASOs. Next slide, please. So creation of the subcommittee. Next slide, please. So in 2022, we had a state statute that stated that we do need to create regional subcommittees, which we are calling the regional councils for the BASO region. So the 4 BASO regions. As you all know, we have 2 BASOs, which is Signal and Rocky, and between the 2 of them, they will oversee the 4 regional councils, and these councils will align with the BASO regions, and so they will all be in charge of specific issues to each of those regions. Next slide, please. So the process for the creation of the BASO regions is it's divided into 2 phases. And so I'll speak a little bit about what phase 1 entailed. Next slide, please. And the phase 1 is really, kind of organizing the council, what the council would look like. And BHA and the BASOs have really been working together very collaboratively to determine the best way to put together these councils. The councils do have statutory obligations. And so the purpose of the councils are to do these 3 things that are on the slide, which is to determine what services are needed, to establish a full continuum of behavioral health care, addressing all the barriers that access barriers within the regions that affect either timely care or the quality of care. And these are, some of the main kind of concerns that have always come up when it comes to behavioral health care. And also identifying the needed specialty services for our priority populations, which is really important to BHA as well. Next slide, please. So here are some of the parameters for the councils, the things that they have to follow. One thing that we've done is, in order to allow for a smooth running of the councils, we will support the BASOs to structure these councils to follow current BHA council structure. And so the BASOs will really be responsible for the administrative functions of these councils, which includes, all of the administrative tasks that we here at BHA provide for our BHA councils like BHAC and BPAC. And then also the cadence of those meetings will really be determined by the council members. We have made some recommendations to the BASOs, which is, the length and the schedule and the cadence of how these meetings should occur. The BASOs will be responsible for compensating the 4 seats of the lived experience seats on those councils. Next slide, please. Here is more information about how the councils will be organized. They would also have to put together a letter of recommendation, kind of very similar to what you all do with a block grant. VS would really focus on those 3 earlier bullets that I mentioned about priority populations and ensuring that there's access and quality of care. So those are going to be the recommendations that they will also put together for the BASOs and BHA. And their timeline is also on the slide, which is that they would have that due to the BASOs by September 1st, and then also the letters of recommendation to BHA by September 30th of each year. Next slide, please. Now into phase 2, which is what Megan really meant. She highlighted that I do need to really focus on this because that's kind of the main thing that she really wants to share with you all, which is the membership, the recruitment, application, and the appointment for the BASOs. So this statute has determined what seats have to be on these councils, the number of seats. I believe there are 9 of them. About 9 or 11 seats And some of them have been determined already about how they would be recruited. Tasha, sorry, I just see your hand up.
I will more than happy wait until after the presentation to ask my question.
Absolutely. Thank you for that. And then, so BHA is responsible for 2 seats, and then we are also going to support the BASOs in recruiting the other seats that they are responsible for. But here are all the seats that are required by statute to be on each of the regional councils. Next slide, please. And here is also more information about the terms for each of the seats, and then also who is responsible for what between the BASOs and BHA. Next slide, please. Here is a timeline of the recruitment and application process. Right now, we are in the process of this, since this is May, we're really working on completing all the materials needed for publication in order to recruit for the BASO, for the regional councils. And so Megan wanted me to make sure that I share this with you all. And the slide deck is going to be in the agenda and in the chat. So please feel free to review this afterward. Oh, there are 3 phases. I missed that. Tools and resources. I think these are just tools and resources that we will provide to the BASOs to support them with standing up these councils. And so we're providing them with the council bylaws. They have to create some for the regional councils. The BASOs have to create agenda meeting templates. We'll support them with a lot of those. Letter of commitment. Most of what we're doing is just using our current councils and boards, the resources that we have available to support them to start these councils. Action items and next steps. Next slide, please. There will be, so what we are doing is, in addition to the commission conversations over the summer, we're also adding the BASO launch activities to this. And so we're going to be doing some community engagement around the recruitment for the BASO councils throughout those sessions. And so we'll really be doing a lot of marketing and promotion of that to recruit for members to join these councils, and definitely looking forward to asking that you also do some promotion for these councils to help us spread the word and to get members to be part of, as diverse members as possible, to be part of these councils regionally. So here are the dates for the virtual sessions for these community engagements for the BASO councils. They are divided into the regions, the BASO regions, and so here are the dates for those. Thank you. And here are some more dates for the BASO launch event. We're going to be doing some in-person ones as well. We have Boulder, which will coincide with Commission's conversation as well. And then Grand Junction is also going to be a combo event, which is going to be both the BASO launch and then also Commission's conversation. And Sterling is also going to be the same. The big day at the Capitol for BHA is the BASO launch event, which is July 9th, and we're all really looking forward to that. And we hope you all can join, most of you can join us on that day. Next slide, please. I think these are all the slides. Yes. So this is a really fast track through that presentation. I'll be happy to take a few questions that I may be able to answer, but we're all looking forward to Megan coming next month to really dig into the process for the recruitment and then the councils and then some of the activities that we have lined up to recruit for these councils. Tasha?
Oh, I really wish the BHAC representative was here to answer these questions because she probably would have the answers to these. So I'm not gonna get on you for transparency because but what is the purpose of going to be of BHAC, Behavioral Health Advisory Council, with these regional subcommittees? Like, where does that fit in? Because
the differences between those councils?
Because it's exactly the same.
That's a great question for Megan, for sure. So I'll put that down and ask her to come, because she is definitely the BHAC guru over
and
here.
Is there by any chance that maybe you can ask the commissioner that? Because I have been asking that question to Megan and I haven't gotten an answer. Thank you.
Absolutely. We'll do that. Thank you so much, Sasha. I see Lauren's hand up as well.
Yes, hi. Are these the regions that there was a map that showed the regions? And okay, I thought there were five.
I do have a BASO map somewhere. I'll have to dig around to pull that up real quick. I realize that we don't have a map on the
So my question is, if I were to go to the state site, state legislature, I could type in my address and find out what district I was in for my representative and my senator. Is there some capacity for us and for the communities that we're involved with to go to a map, type in the address and say, you're in region 1, 2, 3? Yeah, that's what I was talking about.
Thank you, Calandra. I was just first. Yes, thank you so much.
I can't count.
Can you make it a little bit bigger? Are you able to?
Oh, so perfect. I know which one I'm in, but I would like to know which one other people are in.
Oh, I see.
If that makes sense. If they choose to say, I want to be contacted with things, I want to be part of the network in the yellow region, region
4. Region 4, the BASO region 4. I want to make sure I understand your question, Lorraine. Are you asking to know how you can engage with that regional council within your region, or to be a member of the council?
Well, I know that is my region.
Okay.
I want to know if other people that want to get involved throughout the state can go and find out what region they're in and then maybe be in a list. So let's say I was going to go to Grand Junction just for a party, and I thought I might stop in and see some people, building my network. I could look here and see who is in that region, and so I think it would help our expansion of the community.
Mm-hmm.
There's we don't have to tell people. I mean, people can tell us, kiss my swine, I don't want you to have all that information out there, and that's fine. It's just if it's helpful. And it's not individuals necessarily. For example, okay, so I'm in region 4. I would also like to know who are the different entities that get contracts or grant funding, so that I can just stop by and
absolutely,
because that would help me if I were to feedback about grant applications or something like that, or I'm going and finding out what's really going on. Some of the things that we're responsible for, I think that would benefit me.
Absolutely. So I dropped a link to the BASO page on BHA, and I know this page is going through a lot of changes. And so as the BASO contracts get finalized, and they also then work on subcontract, and the council, the regional councils get recruited, and then membership is really determined, this page will be updated with a list of the subcontract. I believe they're going to have a whole site really for the BASOs. And so please keep an eye out, and I will be happy to share as much as I can, and when this page gets updated with more information. I know there's a lot of information that is being worked on, but yeah, I do know that there would be a list of all the contract and subcontract for the BASOs for both Signal and Rocky.
Okay, thanks, Judith.
Absolutely, thank you. Marjorie?
I had a quick question, and I get confused, but I know we have people like for our Northeast regional specialist. Will the regional specialist, are they the same as these what's here?
That's a great
are
question.
They working together? I apologize for being confused, but sometimes I get confused with all of our different people and what they do.
It is very confusing. I agree, Marjorie. Thank you so much for bringing that up. This is something that we've been working on and, messaging as much as we can, because our BHA regional map is different from the BASO regional map. And so what we are doing internally is to ensure that we are really aligned with the BASO regions and working collaboratively as much as possible. And so there will be some overlap of regional engagement specialists across the BASO regions, but please know that we are really committed to ensuring that we all work together in a very collaborative way. And so you could have, Calandra could be collaborating with 2 different BASO regions, just because her section or her area really kind of covers maybe more than one BASO region. So there will be a lot of overlap in that sense. And then, but this is also a great opportunity for us to really figure out, collaborative ways of really working together. Thank you for that. That's a great question. Tasha?
Are these BASO regional subcommittees, are these BHA ran or the BASO ran?
They're BASO ran.
They're BASO ran, so
yeah.
So Signal and Rocky are the ones that are running these and putting these together, not the BHA, correct?
No, we are supporting them in order to stand them up for the first year, just to provide them that support. But no, they are going to be running those councils.
Okay, the only reason I asked that is because what it says in statute does not align with what's being told.
That we are responsible, right? That is my understanding. I will circle back with you on that to clarify. But as far as I know, BASOs are responsible for those councils. Thank you.
Judith, I'm sorry. Can you just tell us if those contracts are signed, the ones that are for the BASO? You talked about they're in the process. Do you know when is that finalized with the Signal and the Rocky?
I believe they are. They've been finalized. Yes. I think they then now have to work on their subcontract. Thank you for that. These are great questions. Thank you. Any last minute questions? I know Hope has a few things to wrap up before we go. I think I'm still next on the agenda. I added some updates to the agenda because I know we didn't have a lot of time for us to go over. So, Calandra, could you please share the agenda on the screen again? I added a few updates that I think would be helpful to see on screen.
And also just a note, we are at 5 minutes, which is public comment.
Right. Perfect. Thank you so much. The bottom. There we go. Thank you. I just had some community engagement updates that I wanted to share. May is Mental Health Awareness Month. We, BHA, will be sending out a toolkit for everyone to use in the community. We are also, I already mentioned the the resource fair at the Capitol and the Basel launch on July 9th. We will be sending some more information on that. I just put in here a tentative schedule for the Commissioner Smith's conversations that I mentioned. We're going all over the state for those. So I'm really excited about that. And I hope you can join us in all the places that are close to you. Our first one is coming up really soon after our, I hope you've all RSVP'd for the Action Summit on May 27th. After the May Summit, we will be starting our travels. We'll start with Alamosa on June 4th. But here are the dates. There's about one more date. We're looking for a Southeast location, likely maybe La Junta. And so I will have that date on here as soon as it's finalized. Lauren? Lauren, you're still on mute. Okay. Thank you.
I'm sorry. I'm
That's okay.
having trouble with my hands. I think you've inserted this into the agenda. Is that correct?
I have, yes. So you can see later.
Okay. Just as a Robert's Rules of Order, it might not be in keeping with those rules because the agenda came out and somebody looked at the agenda and said, oh, there's nothing that I need to go and comment on. And
Absolutely.
then there is something. So it traditionally or general accepted practices, we don't add to the agenda at this late date, but at the beginning we could have said, is there anything under new business? And that might have been proper. So I would just look into that just so that we stay within the parameters of Freedom of Information Act and that sort of stuff. So I'm glad I got the schedule. So it don't make me no never mind, but I don't know how we could have done it differently. You might check with the council attorney or something.
I appreciate you calling that out. Thank you so much, Lauren. That would be on me. I will move this to the meeting minutes. I believe that would be the appropriate place for that. Thank you for
that's a good idea.
Calling that out.
It's always there's always something to block from doing something sensible. No, you can't do that. That makes too much sense. So I appreciate
Thank you so much, Lauren. I appreciate that.
Yes, Lauren, absolutely. Thank you for keeping us on task in that way. And I know we did a kind of informal open for public comment. We have 1 minute left in our meeting, and it's been, we have a lot to go over. This was a lot of information today, and I know we weren't able to get back to Dennis. I am going to do a call to action for our council members to please share the council application. It is in the chat. It is in our agenda. It is on the BPAC website, and we have some other.
Actually, if I could jump in, I built a page on my website, and I have that in the chat that kind of explains everything with links to BPAC as well as the BHA. The video on member orientation is on there. BPAC membership application is linked there. Our Zoom meeting is linked there. And I'm using this to recruit people because it's a nice, concise way of explaining what we're doing. And before we run out of time, I want Madeline to know that even though her actual membership doesn't start until October 1st, you have full rights in the council. You can join any committee. You can even be a committee chair. The only thing you can't do until the commissioner has this approval is vote. And as you can see, we don't do a lot of voting. So I don't want you to think that you're wasting your time here, because you can function just as much as we all The other side of this is I'm going to send out an email tomorrow on an update on my community podcasts. I've got a couple of great ones that came up, and I'll get the new list of future podcasts so people can see that as well. But
Hey, Dennis, thank you so much. We're over time and we need to adjourn the meeting. I know I need to leave personally, so I'm sorry to cut you off.
We will have an opportunity at the next meeting, I guarantee this, to vote on extending this back to the original meeting schedule of 9 to noon, because we have to be able to report out on these subcommittees. I'm putting an awful lot of time and energy into this, and people have great questions, and we don't want to thwart that. So in the steering committee, that is one thing that I'm going to bring up, that we go to extend the meetings back to what we originally had of 9 to noon. So
I'm going to call
there's
the
my
question
soapbox.
because of the time. So I'm calling
Yes,
the
thank
question,
you.
and we'll add that to our executive committee for consideration. Dennis, thank you. And I would also like to make a motion to end this meeting.
Yes.
Thank you all so much.
I'll second that.
Awesome. We will adjourn our May meeting. Thank you, everybody.